media call for August 10th. We'll start today's call with a quick situation report from Health Commissioner Jan Malcolm. We'll then hear more about today's announcement of new guidance related to visitation at long-term care facilities in Minnesota. Commissioner Malcolm will start us off with that discussion, followed by MDH Office of Health Facility Complaints Director Lindsay Kruger. Lindsay will be followed by Aisha Elmquist, Minnesota's Deputy Ombudsman for Long-Term Care, and then Melanie Van Wy. Melanie lives in Stillwater, and her mother is in an assisted living memory care facility in the metro area. She's graciously offered to share a bit of her story and perspective as a family member with a loved one in long-term care. After those updates, we'll open it up for questions from reporters on the line. With that, I will now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Around the world, as of this morning, we were above 19.8 million cases and 731,000 deaths from COVID-19. The United States, as of this morning, had crossed the 5 million case threshold and has over 162,000 deaths from COVID-19. Here in Minnesota, we are announcing today 625 additional cases that came in through laboratory confirmation yesterday on Sunday, bringing us to a new total of 61,516 cases. Yesterday's 625 new case total compares to 799 new cases on Saturday and 915 cases coming through as lab confirmed on Friday. Just to quickly remind folks about these data that are reported each day. What we're reporting to each day is the number of laboratory confirmations that came through the system the day prior. And those laboratory confirmations obviously include a number of days worth of laboratory specimens that were collected by provider offices or community testing events and the like. So when you go back and look at the various analyses we do and the measures that we post, we are doing most of those calculations on the basis of the date the specimen was collected, as opposed to when the lab reported the results back to the provider and to us. That's only important from the standpoint that what you see in these day-to-day numbers that we report each day really reflect what could be a pretty wide variation in the length of time it takes various laboratories to turn around the tests. So that's why we go back to looking at specimen collection date for our more apples-to-apples analyses. Our median age of cases has remained at 36.0 years old now for a couple of weeks, which is down quite markedly from where we were earlier in the pandemic, as we talked about. We reported 3 additional deaths in Minnesota yesterday, bringing us to a new total of 1,660. 2 of these folks were in Ramsey County, 1 in Anoka County, 1 person in their 90s, 1 in their 80s, and 1 in their 60s. 1 of the 3 deaths occurred in a resident of a long-term care facility. On Sunday, there were 320 patients in the hospital, 159 of them in intensive care. And that was a net increase of 8 additional people hospitalized on Sunday compared to Saturday, 11 more in the ICU. These numbers were on a very strong testing volume over the weekend. There were 12,787 total lab tests reported back yesterday. There were almost 18,000 on Saturday and 20,000 on Friday. Our testing volume growth continues to be greater than our growth in cases week over week. So total testing increased 9.5% from a week prior, and cases increased by 8.8%. And that testing growth rate has fallen, the case growth rate has fallen to increase and is now at 5.4%, which is up from 5.2% a week prior. And again, that is based on data through the last week of July, given the lag period that we've talked about on prior calls. So to today's special topic on long-term care visitation guidance. We've spoken in the past about the progress that's been made in our long-term care facilities, and it does bear repeating that in the majority of these facilities, the situation is quite positive. But we've also talked about the fact that infection numbers have gone up a bit in recent weeks, which is a really unfortunate result of the marked increase we're seeing in community transmission around the state. And we've talked about the degree to which that community transmission puts at higher risk the healthcare workers that are in those settings who may be picking up the virus from exposures in the community if they're out at social events and the like, and then unknowingly bringing that into our long-term care facilities. We've talked about that a couple of times in recent days. But even so, the majority of long-term care facilities are still doing quite well. Just to reiterate some of the statistics you heard last week, among our state's assisted living facilities, almost a quarter of them, only a quarter of them have ever had an outbreak. So 414 assisted living facilities have ever had an outbreak. Less than 10% of them, 151 facilities, or only 9% of assisted facilities, have had any cases in the past 28 days, which means that over 90% of assisted living facilities have had no cases in the past 28 days. When it comes to skilled nursing facilities, just over half of them have ever had an outbreak, 54% of the skilled nursing facilities. Active outbreaks, just under 30% of them have had a case in the last 28 days. So over 70% of them, 71%, have had no cases in the past 28 days. We like to just reiterate those statistics just to make the point that the long-term care sector as a whole is working very hard to keep their facilities as safe as possible and have gotten significantly better in partnership with the state health department and other resources in managing cases when they do occur in their facilities. But since March, visitor restrictions have been in place in long-term care settings as a part of the strategy to prevent the spread of COVID-19, and that has been an important tool. And frankly, if our only goal was to prevent COVID-19 infections in these settings, setting firm restrictions and leaving them in place until the risk has totally disappeared might be what we would need to do. But our goal has not been and is not only to prevent COVID-19 infections. Our goal is to maximize the health and well-being of residents in long-term care facilities. And that makes things quite a bit more complicated, especially as the pandemic is now into its 8th month with, unfortunately, little sign of slowing down. So balancing safety from COVID-19 and visitation restrictions, which have been important to help create those safe environments, with the well-being of residents is an urgent priority to limit unintended harms of social isolation. The guidance we're rolling out today will take effect on August 29th of this month. It sets forth a careful and measured process that long-term care facilities can use to determine the most appropriate visitation policy to protect their residents and staff. And with that, I'd like to hand it off to Lindsay Krieger.
Thank you, Commissioner Malcolm. As mentioned, this guidance will take effect on August 29th of this month to allow facilities time to review and create processes prior to implementation. The rollout of this guidance is in continuum with other long-term care guidance we have rolled out over the last several weeks and months. Beauty shop guidance, window visits, outdoor visitation, in addition to essential caregivers guidance, are all in effect and will continue to be in effect in addition to this guidance. The guidance states that the primary consideration for facility visitation decisions should be whether there has been an exposure in the facility from a COVID-19 case in a resident, staff, or visiting service provider within the last 28 days. The guidance has two levels that a long-term care facility will be in, level 1 or level 2. For a facility to be in the visitation and activities level 1, the visitation and activities recommendations should be used when there are active cases or there has been an exposure from a case in the last 28 days. This would be consistent with the same visitor restrictions currently in place right now. For a facility to be in visitation and activities level 2, the visitation and activity recommendations can be carefully implemented when there have been no exposures from a case in the past 28 days or other requirements described in the guidance are met. The guidance provides a series of factors facility management can use to evaluate COVID-19 risk for the facility. It sets forth a clear process for moving to greater level of visitation when factors indicate it is appropriate to do so. As Commissioner Malcolm stated, COVID-19 is not going away anytime soon, and that means we need to be finding solutions that are sustainable over a long term. Residents have been isolated for months, and that presents significant risks for their emotional and social well-being. Walling off residents from the majority of their family and friends is simply not a sustainable approach. But neither is allowing wide open visitation with no thought to the real and persistent risk to health of residents and staff alike. This guidance helps facilities keep their COVID-19 guard up while taking cautious steps towards ensuring residents have more social connections and interactions. Aside from the 28-day history of exposure at a facility, the guidance indicates several other risk factors for facility management to assess when making the decision to move to a higher level of visitation and activities. These include case incidents in the surrounding community, facility size, and the extent to which staff at the facility are working in other long-term care facilities, as well as others in the guidance. As mentioned, one of the risk factors includes case numbers in the community or in the county, which we've aligned for consistency with the school guidance. Per county, 10 cases per 10,000 in a 14-day period is considered an elevated risk. Facilities who border other counties need to assess and take into consideration the bordering county numbers as well. For facilities who have never had a COVID-19 case or have not had a case in 28 days, they may identify risk factors that would place them at high risk for COVID-19 exposure. With this guidance, these facilities may choose to stay in level 1, meaning current restrictions on visitors and activities such as today. We are asking for each facility to assess their own risk. The guidance states facilities should develop testing plans with baseline facility-wide testing within a window of time before or after opening, depending on the facility type. Facilities should refer to existing MDH guidance on the appropriate use of testing in long-term care facilities. A key factor that determines the testing needed when transitioning to visitation and activities level 2, at least initially, is the facility type, nursing home versus assisted living type facilities. Nursing home residents are considered to be at higher risk of contracting and dying from COVID-19, which is why they must conduct facility-wide testing. Assisted living type facility residents are still at high risk, so the facility-wide testing is recommended in the guidance. The guidance does include data which shows nursing home residents are 4 times as likely to contract COVID-19 than assisted living type facilities. In addition to supporting residents' vital connections with family and friends, safely allowing visits can help identify any potential maltreatment or abuse of residents. As the director of the Office of Health Facility Complaints at the Department of Health, I can tell you that we have seen a change in maltreatment reports. The number of maltreatment complaints and reports coming in since March has dropped by 20% compared to a similar time period in 2019, a drop that would not be expected to have happened by coincidence during a major pandemic. The most vulnerable populations do live in the long-term care facilities. It's important that everyone entering these facilities follow strict and current infection control prevention practices consistent with the Centers for Disease Control and Prevention, CDC, the Centers for Medicare and Medicaid Services, CMS, and the Department of Health. The health and well-being of vulnerable adults and the staff who work in these facilities depends on visitors to consistently follow these practices. It may seem counterintuitive to roll out guidance about visitation at the time when much concern is about course of the pandemic in Minnesota and other states, as Commissioner Malcolm mentioned earlier. There are three key things to know about why it actually makes a lot of sense to roll out this guidance at this moment. First, we have a robust system in place to provide support for facilities. This includes significant testing capacity for facilities to use, procedures in place for facilities to request personal protective equipment, crisis staffing support. There's currently more than 1,100 qualified healthcare professionals signed up in the scheduling database, and many other kinds of support that we have implemented through Governor Walz's 5-point battle plan. Second, as mentioned earlier, the vast majority of our long-term care facilities are in good shape, and many would meet the stringent criteria we put in place. And third, perhaps most important of all, we have had strict visitor restrictions in place for months, and that kind of blunt tool cannot be left in place forever without real costs. The well-being of residents requires us to find a way to better balance protection and connection over the long term. We are confident that this guidance we are rolling out today does just that. And now I'd like to turn it over to Aisha Almquist, Deputy Ombudsman for the Office of Ombudsman for Long-Term Care.
Thank you so much, Lindsay, and thank you, Commissioner Malcolm, for the invitation to speak today. We welcome the news that people in long-term care will have more opportunities to reunite with their families. I'm here on behalf of the Long-Term Care Ombudsman's Office and State Ombudsman Cheryl Hennon. The Ombudsman's Office provides advocacy services for people in long-term care settings, and we represent people from around the state of Minnesota. Statewide, every day, we see the deep isolation experienced by people living in long-term care. These are mothers, fathers, grandparents, and neighbors who have given so much to this state and to their families. They have been largely alone for about the past 5 months. Research has shown again and again how isolation increases mental and physical decline. Our office sees daily examples of the suffering and desperation this causes. There are many people in Minnesota whose lives currently look like this. They are alone in a room or perhaps a small apartment almost all day, every day. They leave their long-term care setting only for essential medical appointments, if at all. They may be experiencing physical or mental decline or both because of their seclusion. We mourn with the family and friends of those who have died from COVID-19 in nursing homes and assisted living facilities in Minnesota. There is no easy answer here, and the balance is certainly difficult. When looking at this balance, we must recognize that isolation is also a safety issue. The guidance issued today considers rights and safety. Loneliness, depression, isolation, and heartbreak are all safety issues. Everyone needs others, including those who live in long-term care settings. Families provide emotional and physical support to people in long-term care and help to ensure a high quality of care. They provide needed human contact. They assist with making sure residents take needed medication and are hydrated and eating, and they remain alert for any care concerns. We have seen significant weight loss and other decline in some people in long-term care, some of whom are depressed and even refusing to eat. Outdoor visits and other recent visitation guidance have helped to alleviate some of these concerns, but the guidance today is another necessary step in the right direction. The guidance on visitation issued today is just that. It does not require any long-term care facility to increase visitation and lays out factors that they must consider. For those facilities where conditions allow, we encourage them to take steps now to reconnect and reunite families. Let's put the choice around whether to reunite in the hands of people who live in long-term care and their families. Let's trust that they can make the right decision for themselves and for their families. This can be done safely with precautions, including proper infection control and testing of staff and residents. We hope this guidance will help to alleviate the solitude and heartache that people in long-term care have endured over the past month. And Commissioner Malcolm, thank you so much for inviting us to speak about this important issue. And now I will turn it over to Melanie Van Wy.
Thank you, Aisha. I never imagined I would ever hear my beautiful mother ask me if she was in prison and if she had done something wrong. It all began on March 14th. My sister told me the long-term care facilities were closing to visitors due to COVID-19, and I should go visit because it might be a long time before I see Mom. I remember feeling a tiny pang of anxiety, but shrugged it off, thinking a long time probably meant only a month or two. Into the second month, the realization hit. Though I went for a window visit every week and have been one of the fortunate ones to have an Alexa in her room, enabling my family to drop in and chat, I longed for the pre-pandemic days. We would go to Starbucks and people watch, hang out on Sundays listening to church, and enjoy spending time with my cat Clarence. But mostly, I miss being in her presence and her hugs. I worried about her constantly, being alone with her Alzheimer's. At night, I lay in bed, obsessively putting into my Google search, when will nursing homes be open? In the morning, I awoke in tears. One night when I couldn't sleep, I went to my laptop and began writing. I see her by the window through the sun's glare. She has a smile on her face and she squints into the light, trying to drink her Coke and hold the phone in her other hand. Something a prisoner would do dressed in wrinkled orange. But Mom wears pink and purple. We only talk for 15 minutes. How much can you say between a cold glass window? Lots of smiles, some tears, and half a dozen I love yous. But the pain of us lacking looms heavy in between our glances. The hug we wait for, I wonder when. And in really bad days, if. I reminded Mom many times that there was a pandemic going on and that I wanted to visit, but I couldn't. One time in May, I told her I was writing letters to people, the governor, the senators, the commissioners, to get back in. She said, don't give up, stay strong. However, by late June, it seemed she was starting to become more detached. At times, I wasn't even confident she knew me at all. Even with the outdoor visitation opening up, Mom's facility still required plexiglass to be in between us outside. Eventually, Mom no longer asked me if I was going to come and visit. Instead, she was facing with like, my heart is with you always, or I'll see you in heaven. I had asked the facility a couple of times if I could get in and give Mom a shower like I did before, thinking that now that it was recommended in the state guidelines that families could be essential caregivers, they would let me in. I even inquired about getting a job for an agency so I could work there, but I was hitting walls everywhere, feeling more desperate and losing hope. I didn't understand. They never had one case of COVID-19 in their building. What was the holdup? The final straw was the newsletter from my mom's facility, implying they were going to wait for a vaccine before they allowed inside visits. I didn't sleep for 2 nights. I was consumed with anxiety and anger at the facility, at COVID-19, for stealing my mom. I almost didn't write the email, but suddenly I heard my mom's voice, don't give up, stay strong. So I sent an email to the corporate office telling them I thought it would be treacherous for our loved ones to wait for a vaccine. 2 days later, Mom and I were awarded inside visits for an hour once a week. Jesus had opened the door. On July 19, after 126 days of being apart, I got to hug my mom. Although, because my expectations were high, I left in shock. She had lost quite a bit of weight, and she didn't seem to know me. She patted me when I hugged her. She froze with awkwardness when I brushed her hair. My second visit, I noticed she had not touched her cinnamon roll or any of her breakfast. She commented that it was dirty. I told her it was just cinnamon, and so she ate it. I also noticed her feet needed attention. When I went out into the hall, she said, "No, don't go." When I walked in the door for my third visit, she said to the aide, "That's my daughter, Melanie." If you have a loved one in a facility, I encourage you to not give up. Staff can be great, but they aren't family. If you are a director of a facility, I would encourage you to ask yourself, is not getting COVID-19 the only goal? How is it better not to risk getting COVID-19, but to die of social isolation, suffer from progressing Alzheimer's, not be able to be with family during your last days, or even have a heart attack without saying goodbye? My mom will be 83 on August 22nd, and I'm going to try to find her a sparkly mask so she can be safe and pretty. Mom no longer questions if she's in prison. Instead, she asks me, "When are you coming to visit?" Back to you, Mike.
Thank you, Melanie. Operator, we're ready to take questions.
Okay. At this time, if you wish to ask a question, please press *1 on your telephone. Again, that's *1 to ask a question. We have our first question from Ken Eredol from Carrot TV. Your line is open.
Yeah, a couple of questions on this. The first being the percentages of those that have not had a case within the last 28 days, I know is 90% and 71%. But do you know how many, especially going off of the county data as well, how many facilities could potentially be reopening if these numbers, if it were to be in effect today?
Kent, this is Jan. Welcome. Lindsay, do you happen to have that data available? And if not, we can get back to you, Kent.
So this is Lindsay. I don't have specific numbers right in front of me, but as far as last week when speaking with Chris's epidemiology team and really looking at just the case numbers in the community, there would be about 40 counties that have more than 10 per 10,000 in a 14-day period at this time.
And that would be kind of the cutoff for where you would recommend they not allow visitors, is the 10 per 10,000?
Well, the guidance does indicate that it would be an increased risk if they were over 10 per 10,000. It doesn't necessarily mean that the facility must move back to level 1, as there is a number of different factors, cases in the community being just one of those factors, but it is something for the facilities to consider when assessing their risk for COVID-19.
And I don't know if Jan would take this or somebody else, but I mean, can you flat out say right now whether you would recommend, if things don't really change, say in Hennepin County or in the immediate metro area, whether you would recommend any decent sized facilities to reopen visitors?
Well, this is Jan. I'll take a crack at that. And certainly, as we said, this is not intended to require any facility to do anything that it does not feel is that they are ready for or is in the best interest of their staff and residents. And certainly with the degree of community spread we're currently seeing in a number of counties, certainly including the metro, that is a concern. It does create just a higher risk environment. So, but again, situations are different from facility to facility in terms of their history and their preparedness. I'll mention that Chris Erzin is also on the phone as a resource for us. So may call on Chris as well. But before I forget, I just also want to take a moment to thank Melanie, especially for that very, very moving story, and to thank Aisha as well for joining us today. So again, I think our key point here is we're trying to create path, guidance, some visibility into what we think would be the right process for facilities to make this decision. But a lot of it is very situation dependent.
One last thing, I was just wondering, why 28 days? We've heard a lot about 14, maybe 21 days, but why 28 days?
The 28 comes from, that is 2 incubation cycles. So that's increasingly, we look at 28-day periods to really, feel some confidence that a facility is what we would consider to be controlled or recovered from an outbreak. And I think you've heard Chris and I both talking also about the fact that 28 days is increasingly good period of time for assessing the impact of prior mitigation actions.
That's it for me. Thanks.
Next question, Jeremy Olson from Star Tribune. Oh, hi. I had a question that was off topic. I was hoping to have it later in the cycle in case others needed to talk about this first. But there was a report on Friday dealing with exercise recommendations for people before having COVID, after, but particularly beforehand, given the risks of obesity, hypertension, and different things, the importance of exercise. And it's something that the health department hasn't discussed a lot, as there's been other things to focus on, but I wondered if you could talk about that, the importance of fitness in all populations, because it seems like if you're in better health, your chance of fighting off a COVID and coronavirus infection is going to be a little bit better. Do you have thoughts on this, recommendations on this for the public?
That's a great point, Jeremy. This is Jan. Just in general, the protective benefits of exercise cut across so many different health indicators, including COVID, it appears. But I'll turn to Chris on this one and see if Chris has any more knowledge of the literature on this topic. Chris, you might be on mute if you're with us.
Sorry about that. Am I there now?
Yes, you are. Thanks.
Okay. Thank you. Sorry. Yeah, I don't have anything specific from the literature, but we do know that obesity is a risk factor for more severe outcomes with COVID. And I think that you do bring up a good point that we have really been providing a lot of guidance related to preventing COVID that's very much in the moment and short term, if you will. So wear a mask, socially distance, all of those things. But there are many other things that we can do to make sure that we are staying healthy, eating well, getting sleep. Obviously, we do talk about good hand washing, and then also exercise. Those are all really important things, and those benefits fit us in the long run. So I appreciate the reminder to kind of take a step back from the immediacy of masking, social distancing, and the things that we've been talking about so much to think about the broader public health messages that we haven't focused on as much.
Thank you. Next question, Greta Cole from Mintos. Okay.
Hi, I know we're still probably, I think we're about a week out from 28 days, or 2 weeks maybe, from knowing whether the mask mandate has had an effect. But I'm kind of wondering, how will you know if something like that has an effect? Is there kind of so much background noise with all the other stuff going on, gatherings being held, they're just meeting this week? How will we know if the mask mandate has worked?
Well, Greta, it's a great question. There is a lot going on, as you say, and sometimes it's pretty hard to tease out the precise amount of contribution that one environmental change or another makes, either in driving up cases or in our more hopeful situation in bringing the case growth down. But we will be watching to see the extent to which our experience is similar or different from other jurisdictions that have seen measurable impacts of mask wearing. But Chris, anything to add on this?
The only thing I'll mention is just that one thing to keep in mind is that there are certain settings in which people clearly need to wear a mask and where things are enforced, but there's many other situations in which people are gathering, kind of as you said, the background noise. They're gathering with other people without masks and without social distancing, and so that may make it challenging. So it's great if you wear a mask when you go into the grocery store because they've got the sign and they're expecting that of you. But if you're getting together with large groups of people and not social distancing and not wearing a mask, then the mask at the grocery store doesn't do as much good as the gathering with large groups does bad. So I think that that's one thing we're going to have to keep in mind as we're looking at the data.
Thank you.
Next question, Chris Ceres from Star Tribune.
Thank you. I just had a broader question about the numbers as far as the deaths in long-term care facilities. We haven't really seen, fortunately, we haven't seen those go up in proportion to the increase in cases. And I wonder if you could talk about why that is.
This is Jan. I'll start and then again invite Chris, Lindsay, and actually anybody to comment on this if you would like. Yes, we're very, very gratified that the improvements that have been made in a number of fronts in long-term care have helped to contribute to many fewer deaths coming from among residents of long-term care settings as well. Certainly, we've been talking about the fact that the more recent cases in Minnesota have been predominantly among young folks coming from exposures in social gatherings, and just the age demographics would tend to predict maybe fewer hospitalizations and deaths. But what we really do also focus on is the secondary and tertiary later generations of transmission as those folks may pass the virus very unwittingly onto people in higher risk groups, so that we're always still looking out to what may happen a couple of weeks after we start to see hospitalization numbers increase. And we have seen hospitalization numbers kind of heading back up, but thankfully not at precipitous rates at this point. And that's certainly what we hope continues. But we are expecting to see additional transmission among higher risk groups just with this degree of community spread going on. So Chris or anyone else want to chime in?
Yep, no, deaths are a lagging indicator. So it does take a little while for that to follow the increase in cases. And as the commissioner said, we're seeing more cases in the younger age groups, but we're also recognizing that these individuals oftentimes will work or be engaged with vulnerable populations. And so one of the concerns that we've been seeing more recently as we've seen cases in our long-term care settings is that more of those cases are in staff, meaning that they are being exposed in their other life, if you will, and then have the potential to bring it into a facility. So that's concerning, and that's why we keep emphasizing it's really important to consider all the roles you play as you're thinking about how you engage during this time of COVID.
Great, thank you.
Next question, Mary Devine from Pioneer Press.
Hi, it's Mary Devine from Pioneer Press. I'm wondering if I could get more information from Melanie, including the spelling of her first and last name. It sounded as if she was from Stillwater. I wanted to confirm that. And then also her mother's name and what facility where her mother is living. Thank you.
Yeah, my name is Melanie Benoit, and I live in Stillwater. I don't share, or I don't care to, just in the spirit of protecting my mom, I don't care to say what facility she's in. But my mom's name is Margaret. I can share that.
And I'm sorry, could you just spell your last name and your mother's last name?
Yeah, we have the same last name, and it's Van Y, V as in Victor, A-N, the space, capital W-Y-H-E. Thank you. Yeah, you're welcome.
Next question, Chris Rogers from Minnesota Post.
Thank you. Commissioner or Director Erzman, we saw the rate of new cases in Southeast Minnesota plateau recently and actually improve in Winona County. I was curious if you had any idea why that might be and whether people should relax their daily precautions at all.
Chris, can you take that one?
Sure. Well, I would say that, as we always say, we celebrate every day with low numbers anywhere or fewer deaths. I don't think, however, that the progress that's been made in Winona County means that residents should, take a break from following the guidance on masking and social distancing. I think that it's great that we're seeing some more stability in southeastern Minnesota, but COVID is spreading across the state and across the country. So while I think it's totally appropriate to celebrate the progress and the reduced number of cases, it's not, we're in no place where we can relax our vigilance in responding.
Thank you.
Next question, Peter Cox from Minnesota. Minnesota Public Radio.
Yeah, I'm wondering in this visitation plan if facilities are going to have to put their plans to MDH and get some kind of approval. And as a follow-up, I'm also curious whether how many facilities have taken up outdoor visitation and how many have taken up essential caregiver visitation.
Lindsay, could I ask you to take that one, please?
Sure, this is Lindsay. As far as facilities sending their plans into us regarding guidance, that's not required. The facilities do just need to look at the guidance and the risk factors that are outlined to assess their own risk prior to moving back and forth between level 1 and level 2. Regarding the number of facilities that have in place outdoor visitation or essential caregivers, I do not have any data on that. I'm wondering, Isha, if you have a sense based on the Ombudsman's perspective as to how many facilities have implemented either one of those guidances?
Thanks, Lynn. We have seen that outdoor visits have been implemented in certainly the majority of facilities. For essential caregiver, that's been a little more spotty. So we don't have exact numbers to give. However, I will say that there have been a number of facilities who have declined to begin an essential caregiver program at this time.
Thank you.
Next question, Paul Scott from Foreign News Service.
Hi, I'm just trying to piece apart the logic of this. If the added risk of the visit is the visiting family member, why was the trigger to this change based on the cases inside the facility? Does that make sense?
So this is Jan. I'll just start and then ask Lindsay again to comment. I think it goes to the, again, the sort of the level of the facility's preparation, and the risks inside the facility certainly are a significant aspect of that. And it also goes just to the preparedness of the facility to manage cases well should they develop. But Lindsay, what would you add?
Yeah, thank you, Commissioner. I think one of the things that taken into consideration as well is that if there is one case at a facility, there might be others as well. And so really just trying to make sure that we are watching infection control and not introducing any others at a time where there is an outbreak in the facility. And so that's one of the things that we did need to consider with the guidance.
Great. So just for a follow-up, what are the precautions that are required to screen the health of visitors now?
Lindsay, can you take that too?
Sure, this is Lindsay, and I can start, and then maybe Chris, if she has anything to add. So the recommendations for screening is that there is active screening, so that there is an individual that checks the temperature of the visitors that comes in and asks a series of questions regarding symptoms that they may have had in attempt to identify if they do have any symptoms that have been related to COVID. Another indication for screening is that we are requiring the visitors to sign in and sign out so that if needed, we can go back and do tracing based on where an individual has been. And then also the facility has the ability to monitor the number of visitors in the facility. Chris, do you have anything else to add?
No, I mean, we're obviously our guidance has been very much that, you know, anyone with symptoms should not be, you know, visiting at all. But, you know, as Lindsay said, there are steps in place so that people are evaluated even before they enter the facility. And then obviously need to be masked and that type of thing.
Thank you.
Operator, we have time for one more question.
All right. Okay, last question for Maury Glover from Channel 9, Fox 9.
Well, thank you. I was originally just going to ask if for the spelling of, you know, Melanie Van Wy's last name and location, but while I have you, just what kind of impact do you believe that this change in the guidance or opening up the guidance will have for families that have been, you know, have been waiting to see their loved ones in you know, assisted or long-term care facilities?
Well, this is Jan. Again, I'm going to just say I think we know a lot about the health impacts on certainly the residents, but on families as well. And I think you've heard powerfully about that from Melanie. So I'm going to ask Melanie if she'd like to comment again on that at all, and then Aisha, if you have anything you'd like to add.
I'm just happy that it's taking place, and thanks the Minnesota Department of Health and Jan that you know, they are listing them, and I guess that's all I have to say about it.
Thanks. This is Aisha again.
Still with us?
Yep. Great. Yes, I am. Thank you. We are anticipating a positive impact on people living in long-term care to be reunited with their families. And we encourage facilities, when conditions allow, to take steps now to reconnect and reunite families. We have seen the significant effects that isolation can have on people's mental health and physical health. And there are absolutely things that can be done to make it safe to reunite loved ones and people living in long-term care. And as we've heard, unfortunately, this is a marathon and not a sprint, and we're absolutely concerned about some of the earlier questions, the spike in COVID-19. But we also know that loneliness and isolation are serious health risks, and there's a way we can do this safely with proper precautions. We simply can't keep loved ones in isolation with no end in sight. So we are very appreciative of this change.
Thank you very much. Appreciate it.
That is all the time we have for the call this afternoon. If you had a question you were not able to address during the call, please feel free to reach out to our communications office this afternoon. Have a good day, and we will be back with you again on Wednesday.
You were just watching state health officials give an update on COVID-19. Stay with WCCO and CBSN Minnesota for the latest.
Our world has changed. Jobs